So I'm Lucy Brown, in case some of you may not know me. I have the great pleasure of hosting some of our webinars here at Florence Nightingale Foundation. I'm the Director of Nursing Midwifery Leadership Development and a very proud nurse by background. Today's webinars on who is caring for our nurses and midwives, I should say, and how can we make sure that we're as happy and healthy as we can be inside and outside of work as well. We've got an absolutely fantastic panel of experts for you today, this afternoon, to share their insights, signpost us some wonderful and valuable resources, but also to help and support our fantastic community as well. So just to make you aware of some housekeeping before we get started. So it will be recorded. If you've got any questions, please do pop it in the chat function at the bottom. Lots of you have already found it when you're telling us where you are. So I'll do a quick run through there as well. If you're feeling brave at the end, you can pop your virtual hand up or your actual hand, and I can come to you for any questions to the panel as well. So hold on to any questions you may have, because we want to hear from our panelists first and foremost. Just to make you aware, we do ask if you to not take any photos today, if that's okay. We don't normally say this, but there's a press embargo, so we've got some really fantastic information to share with you that won't be available to the general public and the press until tonight at 1 minute past midnight, I've been informed. So tomorrow you're more than welcome to post the photos you take, but if you would mind waiting until tomorrow, that would be wonderful. Thanks so much. So the topic today is really, really important. As we already said, looking after our nurses and midwives is absolutely critical. It's been a really tough time. I think we've all felt it. I know I certainly have. Speaking to colleagues and friends across the profession, we're all feeling quite heavy physically, mentally and emotionally as well. There's been a lot of pressure of us, a lot of negativity as well, and impact on our health. And we really, really have been impacted because we're always traditionally the ones that care for others and aren't always very good at taking care of ourselves. So now it's time to change that narrative, isn't it? To really start looking after ourselves and role modelling healthy and positive behaviours. We are looking after the nation, we want their health, the population health of the people we serve. So we should be role modelling healthy behaviours to encourage them to do the same as well. We've got a fantastic panel, as I said, and I'll introduce them just shortly. But what's really exciting is we've got the Nuffield, who've obviously kindly sponsored the webinar today, who'll be sharing the Healthier Nation Index survey, which looked at surveying over 8,000 people to give insights into kind of how they're feeling with their own health and well-being as well, and what we can do to help to contribute to that and support as nurses and midwives as well. We've also got the hashtag Find5, so how you can find 5 to make some time for your health and well-being as well. But I won't say too much more of that because we've got a wonderful expert panel. So I'm just going to quickly run through. They'll give a more in-depth introduction as they come on. But first and foremost, we've got Mark Cole here. He's the head of primary care at Nuffield Health. He'll be followed by the wonderful Steve Ford, who's the editor at the Nursing Times. Our very own Gemma Stacey, who is a mental health nurse by background with multiple years of experience and also published our amazing book as well. Our Deputy Chief Exec is here with us as well to share her insights. We also have Rohit Sagoo, who is a current FNF scholar and also the founder of the British Sikh Nursing Association, done an awful lot of work in giving back to the community as well and how that can impact, and also has authored a chapter in the book that I just aforementioned that was led by Gemma as well. And we also have the wonderful Ben Davies, who's the Organisational Development Director in Nuffield Health. And finally, we have Teresa Griffiths, who's the chair of Nurse Lifeline. So some wonderful, wonderful expert panelists who are going to share their insights and signpost you some wonderful resources as well. But also, more importantly, get your feedback as well. We'll be using the Mentimeter, which will be popped into the chat for you. So if you can log on to that, ready for some questions we're going to ask you. We're going to ask you some live questions. So get ready on your phones, your devices to answer the questions that we pose for you today as well. So I think I've spoken enough. Let's hear from the wonderful panel. And it's my absolute pleasure to first welcome Mark Cole to join us today. Mark, over to you.
Yeah, thank you, Lucy. And apologies for any webinar stress after my laptop just crashed on me. But I'm here, I'm live, and can't wait to get going. So if we just move forward, I think there's a very brief introduction about myself. As has been wonderfully presented already, I'm Nuffield Health head of primary care, and primary care service at Nuffield Health includes our private GP services, our physiology assessment services, physiotherapy, emotional wellbeing, and also our fitness and rehabilitation services as well. I'm delighted as a clinician by background to join you all, our nursing colleagues and midwifery colleagues. I have worked with some of nursing colleagues for 17 years in both NHS and independent healthcare. So I will be showing you, sort of bringing you a mix of data relating to what we found at Nuffield Health in the last 3 years. More recently, our Healthy Nation Index data has just been released and due to go out to media and public tomorrow, but also be bringing a little bit of my own experience to the field as well. So if we just move forward, let's start off with launching our first bit of data. So our Healthy Nation Index is our 3rd year of doing that now. It's our own barometer of the state of the nation. And since we've done it in 2021 and again 2022, this year we've got some really nice data to compare. And there are some themes and trends that we're looking at, and what we're going to be doing is sharing about 7 or 8 stats today relating to the state of the nation with regards to our mental health and our physical health. Now, the overarching theme that we've found at the moment in the current data is that our physical and mental health is affected by sort of internal and external factors. And our biggest external factors to ourselves at the moment is the cost of living crisis. The last couple of years, we've obviously lived through a global pandemic, and that was a big theme of both our 21 and 22 Healthy Nation Index. But this year, there's still a little bit of a hangover from the post-pandemic time, but the number one focus that we're seeing is people's thoughts and reflections on the cost of living crisis. And what that's done from the stats you can see on the screen is that 59% of people believe that the cost of living crisis is affecting negatively their mental health, and 60% are saying it's affecting their physical health. The mental health you can totally understand as to why that is. We've got the internal and external stresses of cost of living, and physical health. We'll come on to some of those factors shortly, but we've got things like the, eating healthily, paying for physical activities, etc., that we're just contributing. Now, in the last year, if we move forward, what we're going to do is just focus a couple of stats, focus our attention on a couple of stats relating to how we feel things have got worse. So just moving on to the next slide, you can see that people are reporting in the past year, 34% of people said their mental or emotional well-being had got worse. And 35%, so about on par, had said their physical health had got worse in the last year. And that's actually something that's creeping up year on year in the Healthy Nation Index data that we're seeing. Each year, things are slightly getting worse. Now, what we wanted to highlight, fascinating because I'm smack bang in the middle of this age group, actually, between 35 and 44. But that was the generation that was most greatly affected with a decline in their mental health, with almost 40% actually saying that their mental health had got worse. Now, when it comes to releasing more of this data in weeks to come, we'll start to unpick and add on some context as to why that might be. My first thought straight away is this is the age group that we're finding is part and parcel of what we call the sandwich generation. This is the age group where they've got caring responsibilities, not just for their children or people they care for, but also the people they care for that are older than us, our parents. So it's not about what sandwich you might want to choose at a high street supermarket or high street fast food chain. That's not the type of sandwich we're talking about. It's about being squashed in between the care and responsibilities of those elders and those are youngers. And within the health and wellbeing sector and nursing and midwifery, we've obviously got the stresses that comes in that professional group of caring for our patients as well. So within the individual that are on this call, there's multiple factors that these people are carrying potentially the burden on. Now, if we move forward, we can just look at our mental health. And the next slide will just give that comparison of how things are looking over the last 3 years. So on the next slide, you can see that in 2021, the percentage of Brits that have gone to work despite being in a state of poor mental health is going up. 53% in 2021, 60% in 2022, and 63%. So that's 10% in 2 years increased of people reporting going to work despite being in poor mental health. Now, this slide is fascinating, actually, because we've got some benefits to this. So actually what this is showing that some people are potentially still trying to undertake normal activities despite being in a state of poor mental health, which is actually good. As professionals, we should be advocating trying to maintain some type of normality during times of going through stress, depression, low mood, etc. And when we are feeling quite low around things that are, internal and intrinsic or extrinsic to ourselves, actually maintaining that sort of standard, that normal activities is very positive. But also on the other hand, you're looking at this data and it's showing that actually we are getting worse with regards to our state of mind. Now, if we move forward one more slide, we've just got a single stat to show you, and that is that 65% of Brits are saying they're less productive when they're at work if they're in a state of low mood. Now, this is huge. Not only is this the previous stat showing that our mood is worsening, it's also showing we're going to work in this state, but this is really alarming that when we are then at work, we're less productive. Now, for nursing, medics, midwives, physiotherapists out there working across the country in the NHS and in the independent sector, being less productive can be, really quite an additional stress on you. So if you are finding that you are in a place of low mood, stress, and actually feeling quite that you're not as productive as what you can be or have been in the past, that then can increase your stress and strain further. So it really is fascinating that we are openly saying that we're not as productive in the workplace due to poor mental state. Now, when we look at the causes of mental health, we have external factors, and we've already touched on the cost of living crisis is absolutely a theme that's resonating. But we've also got to look at our intrinsic factors that might be contributing to poor mental health. Now, there are a number of physiological things that can affect mental health, whether it's underlying medical conditions that you might have that might be affecting mental health. But from a behaviours and habits perspective, the number one theme or the number one reason that can contribute towards poor mental health is sleep. And if we move to the next slide, we did ask some questions in the Healthy Nation Index around sleep. And what the data is showing us once again is that 2 in 5, so that's 40% of Brits have said their sleep has worsened in the last year. Of that, 48% stated that a lack of sleep is having a negative impact on their mental health. And what we've got to do is look at, is this a cause and effect? So is, as a foundation, are we, in a state of stress and, low mood, and that's contributing towards poor sleep? Or is the poor sleep having a direct impact on their mental health? So depending on how you unpick the data and start from a professional perspective, start to understand this data really opens up a huge amount of discussions around sleep. Now, when we then look at our nursing midwifery colleagues who are often working shift patterns, you might be doing nights, you might be doing 12-hour shifts. It's really interesting to think about sleep, not just you as professionals, but when you are talking to your patients who you're dealing with day in, day out. Sleep, we know the data is telling us that our sleep is worsening, but actually the importance of sleep on recovery, growth, strength, being prepared for the day ahead, all of that is vital. Now, if we go to the next slide, let's actually unpick a little bit more about the data as far as the actual hours. So in those surveyed, we are reporting that 5.91 was the average amount of hours that we are gaining per night. And that's actually worsening than the previous year. So that's 20 minutes less than the previous year. And you might think that doesn't sound a lot, but if we're only talking about, close to 6 hours, 20 minutes of the percentage is quite high. And it's certainly a lot lower than the NHS recommendation of 7 hours a night. In fact, it's 15% lower. Now, while we're talking about NHS guidelines, if we move forward, let's see how we're doing in that physical health state with regards to the NHS recommendation. So as far as physical activity is concerned, the NHS, they do have guidelines around the 150 minutes a week. And alarming, actually, 76% of people are still not reaching that recommendation of 150 minutes. So, 24% of us are hitting that, and the remainder, which is a high percentage, are not achieving that 150 minutes. Now, in the last sort of 12 months, we will continue to do this in the next 12 months, is pushing the campaign around Find 5. Let's find just 5 more minutes each day to do a little bit more activity, whether that is activity to benefit our physical health or activities that might benefit our mental health, whether that's meditation, mindfulness, whether that is walking. And what I'll be pushing over the next few days and in the weeks to come is, how can we find 5? Is it when you are on shift and you're walking from ward to ward, instead of taking the lift, can you take the stairs? Instead of taking the elevator or the escalator on the underground, from the underground to the overground, could you take the steps instead of the escalator? All of these little things can help you find 5 minutes extra a day to really build on improving our health as a nation. So there are just a few stats that I'm happy to come back through and answer any questions at the end of the panel. But really just wanted to recognise it is hard out there at the moment, particularly in sort of health and wellbeing. We've just had the last couple of years and it's been, we've been in crisis with regards to a health pandemic. And as we come out of a pandemic into a new challenging environment, then we just want to reference that. So thank you from me to all of you that have worked hard in the last few years, and look forward to chatting to you later on the panel and take any questions that this presentation might have facilitated. So that's me done, and I believe I'm handing over to Steve. So Steve, thank you very much.
Hi, yeah, good afternoon, everyone. So thanks to Mark for sharing that fascinating data and his insights, which I think is a warning to us all, especially about the sleep patterns. Very, very interesting indeed. So my name is Steve Ford, and I'm the editor of Nursing Times. It's a pleasure to be taking part. And thank you very much to Florence Nightingale Foundation and Nuffield Health. So yeah, I've got a few moments to talk to you about a topic which is obviously incredibly important, namely your own well-being as nurses and midwives, as staff and as people. First, I'd like to explore a few factors affecting nurse well-being, and then second, I want to talk a little bit about a campaign that we've been running at Nursing Times to try and support that. So point one, there will be a little bit of overlap, I'm sure, with the other speakers, but well-being is a term that seems to be everywhere these days in the media and the high street, etc. But still too often, despite events like the one taking place right now today, and some growing awareness, its importance for clinicians like you is still woefully neglected, as far as I'm concerned. Rightly, the emphasis in health and social care is on patient well-being. You can't have that without staff well-being as well. So at Nursing Times, we hear a lot of stories from staff who write about the challenges that they're facing and how it affects their life. And also how people deal with those pressures and stresses. So some people use tools like reflection to process situations. Of course, others just carry on regardless. That word, that phrase, resilience, that gets used rightly or wrongly. And obviously, just others just sadly just are clearly made ill by the challenges that they're trying to face. So very quickly, what are the main factors that are negatively affecting well-being right now that we hear about Nursing Times? So this is very much a sort of a macro level looking down. But the first one you'll be unsurprised to hear: workforce, or put another way, workload, driven by staff shortages. It's the big one, I think. Although the actual NHS workforce is growing, it's not doing so rapidly enough to meet demand. And that's without mentioning, of course, social care and other sectors. Staff shortages were a problem before the pandemic, and they're even worse now, I think, due to the retirement bubbles. In that I mean people delaying retirement to help out with the pandemic, or in fact bringing forward retirement after the pandemic, basically just because they've had enough. So, and of course, there's also the impact of long COVID, for example, and burnout more generally, all affected by the pressure to catch up on routine procedures and referrals, and the annual winter pressures that never truly go away. So I think it's certainly not an overuse of the phrase that we have a workforce crisis. And then, of course, there is, as Mark has already flagged, the cost of living crisis too. That is to say, the fall in the real disposable incomes, driven by inflation, by a range of course, factors like the pandemic itself, the war in Ukraine, global supply problems, Brexit, etc., etc. It's a problem affecting most of the country, but of course also NHS staff, and of course that's led to the recent industrial action, etc. So it's all tied in together with pay and things like that. Neither of these, of course, are a surprise. I'm sure people's well-being is an individual thing that's affected by micro factors as well as these macro factors that I mentioned. But I think the key point for me is that one affects well-being at work and the other at home. So it's a double whammy, essentially. You can't get away from these stresses. So I'd like to explore in a little bit more detail the Are You OK campaign. So if we're going to bring up the first slide, that will be fantastic. So basically, way back in April 2020, which seems a very long time ago, at the start of the coronavirus COVID-19 pandemic, Nursing Times started a campaign. Essentially, we could tell that the impact on well-being of nurses and other staff was huge. Just the sheer enormity of it. So we started this campaign to try and hopefully provide some support. The initial kickoff for that was a survey of 3,500 nurses, and as you'd expect, people rated their mental health pretty badly. A third of people at that time, bad or very bad at that time, and 50% described themselves as a lot more anxious since the start of the pandemic. Next slide, please. So I won't go through them all, but the general aims were to try and raise awareness of mental health and nursing before and during and after the COVID-19 pandemic, as it obviously is still there. Try and identify the factors that have contributed to the stress on staff, and basically just act as a barometer and try and use surveys like the first one, but also further down the years, which I'll come to in a minute, to try and monitor what was happening and how people were feeling. And also we wanted to basically get employers to try and do something as well. Again, I'll come to that in a second. And obviously provide some practical help as well via other organisations like Nurse Lifeline, who I think we're going to hear from in a minute. So next slide, please. So yeah, we got employers to sign up to a pledge. It was quite tough going at the time. We hadn't got that many staff either, and obviously all the other organisations out there were trying to deal with a pandemic, so they hadn't got a lot of time either. But we did manage to get 20 or so people to sign up to this pledge, which was basically to support nurses and their staff proactively. So that's something that we need to push a bit more on. But yeah, thanks to all of these organisations that took the lead. So next slide, please. And we also got support from a range of other organisations who said that they were backing the campaign, that were all listed there, some of whom I'm sure you'll recognise. So again, a thank you to them. And next slide, please. And so to this year, as I said, we wanted to basically keep measuring what was going on. So we carried out another survey, basically with the same questions as the first one that we did back in 2020, but with a few added to try and compare. And basically we published these did the survey in January and published them in the February issue of Nursing Times. So as I'm sure you realise and would expect, nurse mental health and wellbeing, it's continued to be a major problem, if not got worse since the pandemic, due to all of the various factors that I mentioned at the top. So essentially, we changed this from being a campaign that was very much about staff wellbeing during the pandemic itself to one being continuing, just trying to take note of the fact that this is a problem that is ongoing. It's not going away, and if anything, it's getting worse. So next slide, please. So, yeah, we asked, how would you rate your overall mental health and well-being right now? And sadly, there you go, 34% said bad, 8% said very bad. So, you know, that's what does that work out as? That's 40, that's 42%. There we go. So just under half bad or very bad. So next slide, please. And this is the comparison with the pandemic. So yeah, the big one there is that 47 and 14% said that their well-being was in fact worse now than it was before the pandemic. So this is 3 years later, 4 years later. So yeah, not good. Next slide, please. And again, how is your overall mental health health and well-being now compared with the peaks? So again, it's a similar story. So next slide, please. And what are the main factors? Again, this is sort of essentially giving a little bit of evidence to what I've said already. Staffing is the big one. Cost of living crisis is a second, and then all the other various factors that are sort of tied up and linked to the first two. So concerns about patient safety linked to staffing, pay, of course, linked to cost of living, etc., etc. So thank you. Next slide. That might be the last one, actually. I'm not sure. There we go. Yeah. So essentially, thank you for listening about the campaign. And there's a few organisations listed there at the bottom as well who can help you find out more information. So basically, yeah, just to summarise, from based on our survey evidence, it's not good news. Sadly, situation appears to be getting worse with wellbeing and how staff perceive it. But one final thing to point out as a positive: lots of organisations are trying to do their best. It's something that we want to support as well through Nursing Times, which we do with our Workforce Awards. So we've got a specific category for the Best Wellbeing Initiative. So just a quick shout out to the current holder of that, which is the Royal Free NHS FT, which won the award in 2022. So there is some good stuff going on there as well, just to get away from the obviously important fact that things are bad. So that's it from me for now. Thanks very much for listening. As I said, there are some links on the slides there to get more support. And just to repeat again, I don't think you can have great patient care without supporting staff wellbeing too. So thanks again. Next up is Gemma Stacey, who is the Florence Nightingale Foundation Deputy CEO, Director of the FNF Policy Unit, and a mental health nurse. Thank you.
Thanks so much, Steve. And I guess, first of all, to say what we're hearing so far on the webinar is that the evidence and the case for the challenge around mental health wellbeing is clearly identified. And that's in the wider population of the people we care for, of which all of our workforce are part of, but also, as we heard from Steve, specifically within the nursing and midwifery workforce as well. And my experience of this as a mental health nurse that spent the majority of my career focused around the mental health and wellbeing of the workforce and developing strategies and forums to enable better mental health support is that there's a disconnect at times with the way in which organisations respond to this issue, in that often the individual practitioner feels that it's their responsibility to identify better ways of coping with the unmanageable stresses that they experience as part of the practice that they're engaged in, and also in terms of their wider world. And so what I wanted to share with you as part of the webinar is how we can think differently as leaders to influence wider culture which supports well-being, and what all of our roles can be within the solutions to these challenges. So if I could get the next slide, please, thank you, and then the next one. So what I'm going to share with you just now is a collection of what the evidence tells us. It's drawn from the wider leadership literature outside of our health and wellbeing sector, and also as part of my learning as a mental health nurse who has had a focus around this particular area in terms of my own practice and research and the education that I've been involved in. And right at the top of my list and really central to this agenda is that this cannot be addressed. The health and well-being of our workforce cannot be addressed if we don't have a culture which is underpinned by psychological safety. Now, this is a term that people are becoming increasingly more familiar with, but prior to the pandemic was largely unheard of within our rider rhetoric. And what I mean by psychological safety is a belief within the teams, within an organisation, that it's safe to take interpersonal risks without fear that there'll be reprimand or punishment as a result of it. And this is usually applied to things like questioning, raising concerns, being able to learn from mistakes, explore where there's been failures in care in a manner that encourages learning and development as a result of those things. But in this context, what I mean by psychological safety is that for a professional to disclose that they are having challenges with their mental and physical well-being, or that the nature of their work is impacting negatively on those things, is an interpersonal risk. And it's risky for us to do that as professionals because there remains huge stigma around this for us as helping and care providers. And part of that is because of this rhetoric that Steve mentioned around the resilience of healthcare professionals. So a sense that we have some kind of an inhuman ability to be able to withstand stresses and pressures, and that we have a higher level of capability to do that. And where that is not the case, that we perceive ourselves as not able to undertake the role effectively, or somehow not coping, and therefore that there could be poor treatment towards us, stigma and those types of outcomes as a result. So the first thing I really want to emphasize is that culture of psychological safety, the way in which we encourage our team members to take interpersonal risks in all of those areas, will either enable or inhibit the ability for staff members to have open and honest conversations around their well-being and the factors that are affecting that. And when I talk about our role as leaders, I'm not just talking about those of us that have leadership roles as part of our job titles. We all have the opportunity, no matter what level or role we take, to influence that culture of psychological safety, just in the way that we respond to people asking questions, raising their concerns, starting to demonstrate some of that self-disclosure around the personal side of their worlds. And we can do that with all of the interactions that we have with all team members, irrelevant of role within the professional hierarchy. My second point is really about the way in which we use our interpersonal skills as professionals to really listen when people do get that courage to share some of the challenges that they're experiencing, and that we listen to really hear that person, not to problem solve or to give our advice or to tell them what we think they should do or what we would do in that situation. And that takes real skill, but it's a skill that we have as nurses and midwives. We listen with fascination every single day in our practice. It's how we really understand the needs of the people that we care for. But we often don't apply that same principle when we're talking to colleagues. So quite often we'll listen to a problem and we will advise on the solution. And what that does is that it cuts off our insight into that person's perception and insight into the issues that they're facing, and also their appraisal, their personal appraisal of their capability and resources to be able to manage that. So often when we tell people what we think they ought to do or advise them, we're giving them an insight into our appraisal of their situation. And we're talking about our coping strategies and resources that are available to us. So a way in which we might manage a problem to do with our health and well-being is very individualised and is person-centred in the same way that we would respond to the people that we're caring for. We can also look at the issues within the workplace that are impacting on well-being as leaders, and we can make small changes that can make a big difference. The NHS employers and the NHS Confederation have published some very simple guidelines around what we can do within our day-to-day to really enable our workforce to take care of their mental well-being. And these are really simple things, like making sure people do have opportunity for a break and access to hydration, that people have opportunity to debrief at the end of their shift, a way of leaving some of that emotional impact of the work that they've engaged with within the work environment, rather than it ruminating and them taking these things home with them. And also how we can enable professional connections amongst our colleagues as well, so that we're not just orientated towards the tasks that need to be done, but that we emphasize the importance of those working relationships. And what we found from the evidence is that even in the most highly pressured scenarios and situations where there is an emphasis on collegiality and belonging, that has a massive impact on the staff members' ability to sustain working under those conditions. So it's quite astounding how much relationships can be a mitigator to the impact of high levels of emotional demand as a result of work. We're quite behind the curve in the NHS in terms of how we work flexibly with people to enable them to accommodate their whole lives. And our student population are really challenging this. They're putting and our early career population, they're putting a real spotlight and pressure on us to think differently about how we manage our staffing, and we think about how we do off duties to enable those individuals to be able to balance their work life with the things within their personal lives that enable them to maintain their energy and really have that integrated approach to our lives. And this is pushing us in a different way in terms of our working practices. Now, what we hear, and we certainly heard it at the Nursing Times Workforce Summit, is this is being met by a bit of resistance. So our established colleagues are questioning, is this the right thing? You know, when I came into nursing, this just wasn't a conversation that we had, that we committed our whole selves to our profession and accepted that there was a self-sacrifice as part of that. Well, that isn't flying currently with the generation of nurses that are coming through, and we do need to think differently about how we respond to them. As leaders also, we need to think about our role modelling. So one of the things that I know I'm guilty of is really trying to give that permission to put that boundary between work and home and really protect that time to engage in the things that re-energize and balance our worlds. But actually I'm terrible for role modeling that myself, and every time I do that myself, I undermine that message within my own teams. And I also give an impression that I'm saying this for you, but it's not okay for me. So one of the things that I am really committed to is role modeling, practicing what I preach. And part of that as well is to demonstrate our own vulnerabilities as leaders. Sometimes we can really perceive those in more responsible positions as almost superhuman, able to respond to every scenario and situation in a way that they are calm and collective and able to deal with that issue and respond to deal with another the next day. But actually being open and honest about the impact that has on all of us and the sources of support that we're seeking in order to be able to appear to hold it all together on a day in, day out basis is really important as part of that role modelling process, to such an extent that it's important to be able to show when we've sought out additional support, maybe for our own psychological and physical well-being, and required some of that time out to do that. Also, as leaders, I'd really encourage you to educate yourself about mental health. And we have had the rise of the mental health first aiders, which is all about really helping us to identify early warning signs that somebody's struggling, that they're not coping in the way that they might typically for themselves. And that's really simple things like how they are communicating, if there's been a change in their appetite, their sleep patterns, just whether or not their tolerance and patience has changed, right the way through to more concerning areas where people might be sharing with you some thoughts which make you think people are experiencing unusual beliefs or hearing things and seeing things that others can't. And what I've asked the team to do is send with our follow-up email today some guidance that's come out from Mind, which is a mental health charity, of what leaders everyday things we can do to look out for those early warning signs, and some really excellent tips about how we respond to that so that that person ultimately feels supported to share the challenges that they're experiencing. And then just my final point is to really pay attention to our colleagues and your employees, the factors that impact on their energies. So for every single one of us, there was a real sense of commitment and motivation to pursue a career in nursing and midwifery. There's a story within every single one of us as to why we're here and why we followed this particular path. But actually, for many of us, it's difficult to connect with that on a day-to-day basis. And it may be that what we're finding is that our working, our day-to-day is actually depleting our energy. It's depleting that opportunity for us to have those kind of sweet spots within our day that make us think, yeah, this is why I'm here. So what I'd encourage you to do is really understand that for your team members and think about how you can organise and delegate tasks that gives opportunity for people to fulfil those motivations and those values every single day in what they do. We won't get the opportunity to do that day in, day out, but we can find moments of connection with that internal why. And you will be amazed at the energy that you start to see in people when we give opportunity to do that. Similarly, taking notice of the tasks that maybe you would delegate to people that they perhaps keep putting to the bottom of their priority list or really seem like a burden for them. And what we tend to find is if we know our teams well, what's a burden to some is an absolute joy to another. So we start to think differently about how we do that delegation. So they're the key messages from me to you all as leaders. And just on the next slide, just to flag up, and there's no plug here, I promise, but I hope that the book that we wrote recently around health and well-being at work might provide you with some really helpful ways of addressing this as a whole system approach. So really trying to give you case studies, authentic and evidence-based, impactful interventions that you can, every single one of us can implement within our workplace. And I'm really thinking about that, that there are things as individuals we can do, and we all need to take responsibility for our health and well-being. But actually, how as a team, how as a service, how as an organisation can we take this forward so this becomes part of our culture? So I'm going to hand you over now to Rohit Sagu, who is a children's nurse and also founder of the British Sikh Nurses Association. And the reason why I'm particularly proud to hand over to Rohit is because he is a contributor to this book. Rohit wrote a chapter around how we can support staff who are fasting for various different reasons, but partly because of their cultural beliefs. And also I'm very proud that Rohit is a scholar and will start his scholarship with FNF in May. So over to you, Rohit.
Thank you very much, Gemma, for that wonderful introduction as well. Hello, everyone. So my name's Rohit Sagu. I'm founder and director of British Sikh Nurses. I'm also a children's nurse, have been for 22 years, and currently doing a funded PhD with the University of Bedfordshire, looking at child and maternal health services in Luton. However, what brings me to this webinar is the question that was posed in terms of how do you find time for your own well-being and act and how you act as a role model for patients and those in the community that you work with as well. Next slide, please. I'm going to start off with, I think, a very most apt and significant quote that I found, that I came across. And I think it's more so than ever that this quote really needs to be paid attention, and not from a UK nurse perspective, but also from a global nurse perspective. And really, it's what it says in terms of, I believe, everything affecting our society affects nurses, that eventually will hemorrhage over to the nursing profession. And that cannot be so true as it is today in terms of what's going on with globally within the nursing and midwifery world as well. So it's really about thinking about how we give attention to ourselves as well. As we know, as nurses, health and well-being is affected by the demands of our workplace, and in turn, that affects how we care for people and our patients as well as many other areas as well. We've seen during COVID-19 and post-COVID-19 the new challenges that we need to now face in terms of our well-being as nurses as well. But it's offered us, if we think positively, it's offered us opportunities to give us nurses well-being, us nurses the well-being attention that we so thoroughly deserve, and address the systems that we have within the NHS and our other providers in terms of structures and policies to create that workplace and avoid hazard and stresses that lead to us having burnout and fatigue or poor physical and mental health as well. So this issue, I think, has greater urgency than ever before, and also in the coming years, it will also have greater urgency as well. So for nurses to address everything that we need to in terms of our health and well-being is so much more paramount today than it ever has been before as well. We also need to think about now, ever more so, is the social determinants that actually influence our health and well-being, from poor housing to economic and financial difficulties that we're currently facing as well. And in terms of also internalizing it with the first that we've got to really think about feeling healthy and well supported ourselves within the team as well. And I think there's a responsibility for policymakers and employees and other nurse leaders and professional associations to really ensure that we have our well-being is taken care of as a nursing workforce. So in terms of those things as well, I want to also look at a framework in terms of what we've also, what I've kind of thought of over the last, I am reading off a script a little bit, so in terms of a workforce, in terms of a framework that we really need to think about in terms of nursing as well. And if we think about nursing, it comes in terms of 3 levels in terms of what we have. The first level is on external environment in terms of really affects us as much as we can in terms of our health and well-being. And that is represented by the laws, regulations, and societal values that are put onto nursing as well. And the second level is the healthcare organization. And I think it's really important that health leaders and management and the governance and policies and structures of organizations must take care of our well-being first and foremost as well. And the third line is all of us as frontline delivery nurses in terms of representing those interactions with our team members, our organizations, our patients, the technologies in our workplace, and the physical environment that we work into together as well. And it's really about considering how nurses are coping in unrealistic workloads as well. The insufficient resources that we have, the protective equipment, the risk of infection, we've seen that from COVID-19, the stigma directed at our care workers, and the emotional and moral burdens that we have for caring for our patients as well. And that really has a significant impact on ourselves as well. I also want to take one extra additional viewpoint of the health and well-being for nurses as well, and those are those from, as I represent British Sikh nurses as well, and also am part of a forum for the diaspora nurses that includes very many international nurses from Nigeria, Caribbean, Philippines, Malawian, and Uganda. We really need to think about it globally from how we're doing, really significantly make an impact on well-being as well. So thinking about our internationally trained nurses is also there as well. If they're laid quiet, if not, they're not saying very much as well. How much of their, well-being is being affected? ESOL as well, English as a second language, could be difficult for some of those international nurses in terms of some of the nuances that are said by patients, some of the colloquial sayings within the British grammar in terms of it. I say that loosely, but British grammar. So it's really think about their well-being and impact as well, and their transition from their country to this country, from their home native country and their home native culture to the transition to the UK and the UK culture as well, and trying to transition and adapt to that culture as well. So that's really paramount in terms of the way we need to think about well-being for our fellow partners and international educated nurses too. Next slide, please. Okay, so in terms of it, so I really thought about when I was posed this question is about the well-being effects of how we have factors to support this and how we can have some kind of impact or evaluation from this as well. So how we can answer these deliverables in terms of what we have. So really, if we think about it, well-being affects individual nurses and teams from their physical and mental health, which we already know. And also in terms of their professional satisfaction and job satisfaction and engagement with their job as well. So nurses really need to feel holistically healthy and well supported, and this needs to be recognised by everyone in the industry and beyond as well. So recognise those bespoke and individual needs as well, that we're not alone, that one size fits all, and that all our well-being needs are individual. So as we've heard from Nuffield Health themselves, we've seen 24% engage in 150 minutes of activity and 76 not. So there could be very, very many reasons why those 76% don't engage in those activities as well. So it's really thinking about bespoke or individual needs and addressing those individuals instead of a one size fits all. It's a nursing idea of well-being may not match their work colleagues as well and their principles. So really thinking about the journey of what their well-being could consist of. So it may not include exercise, it may not include everything. It could be very many other activities that we could have in it. 5 minutes out in terms of relaxing, finding time to sleep. That's paramount in terms of some nurses as well, just finding time to rest as well. And thinking about their day and how they plan their day as well. So we have heard from Mark already, who said, finding 5 minutes a day just for yourself can be sometimes impossible for nurses as well. So really thinking about where our time goes as well. The factors are in terms of preventing the roadblock for wellbeing nurses. We identified already pressures, burnout and fatigue, but it's about detecting those early and really thinking about the principles of management and policies that are in place within the NHS to really detect early burnout and early fatigue and what we can do about it as well. And there are wellbeing facilitators within the workplace that you can address these problems as well. So it's about meeting them early and really getting that help at a very, very beginning and early detection for that help as well. Recognizing social factors that contributed to negative well-being as well. So such as we've already said, the cost of living crisis. And mortgage rates going on, the inflation rates, and putting food on the table as well, and considering our mental health as well in terms around that as well. And considering other social factors such as structural racism, cultural racism, and also discrimination, which affect wellbeing nurses of colour. And that can't be said even more so than now as well, since we've seen many cases highlighted within the NHS, that this is paramount to deal with as well. And it's also really thinking about those structural systems within racism and discrimination that really can affect well-being, so far as to say that nurses may be off for some time, off work for some time, tackling those issues as well and supporting people within those issues as well. Managing time for yourself within a busy work schedule and life schedule is something that we all consider doing. I certainly consider doing, managing my time between my PhD and between everything else I'm doing with British Sikh nurses as well. And you do say it's impossible to find the time, but is it? You've got to question your time and how much you're doing it, and what you're prioritizing within your job. And then coupled with that, we've got family commitments, we've got other commitments outside of work as well that need to have attention. So really thinking about it in terms of what we can do structurally is really think about support. Is improving the well-being of nurses requires a multi-level and multifaceted approaches for addressing physical, mental, moral, social health, and create a safe space for nurses and a supportive and ethically grounded environment for nurses as well. The future demands of nurses we know will increase over the next few years. Therefore, addressing our well-being is is absolutely paramount. I use that word so many times, but it is. And approaches in supporting well nurses can't be short term. It can't be discrete initiatives. They have to be embedded systematically into every nursing aspect of nursing, from education to retirement and every practice setting as well. Inclusive, also saying that it needs to be in the curriculum as well. For those who are training student nurses, you need time out, and there should be periods of time out. There should be periods of support in terms of your well-being, and also factoring well-being as probably underpinning some of the modules that take place within the curriculum as well, to say that well-being needs for nurses needs to have attention. I think that's my time. Next slide, please. But this is a quick Mentimeter for you as well. So what are you doing in short bursts of time that you have? So if I hand it over to you, we can just go over the results.
And just as a reminder, the code, and oh, brilliant, people have already found it. The code is in the chat function for you. I'll let you crack away. I'll resend it again so you can answer the question that Rohit's just posed. Thanks, Rohit.
Yeah, you're welcome.
It's also at the top of the slide as well.
I think it's still coming through, but quite clear.
Yeah, it's quite clear. It's quite clear that everyone loves TikTok. No, I honestly, I'm going to say, I have, when you look on your phone, it gives you an average of what you spend in terms of time on the phone. And I looked at it, I had my report this morning from my phone that says what your average spend, and I probably spend between 8 to 10 hours a week on TikTok. And so, yeah, scrolling through your phone is beneficial. You know, it depends on what you're reading, it depends on what you're absorbing from the information that you're having. But yeah, scrolling through your phone is definitely something that's probably depends on how you look at it as a leisure time activity as well.
But could be that time spent could be spent doing some meditation or perhaps like five as well. So just something to think about when we say we don't have time. Sometimes we do, don't we?
Yeah.
But equally, TikTok videos can be very amusing as well. Not that I'm very au fait, I must be honest.
The gym, obviously high up there as well. So that's good for this webinar in terms of what we're doing as well, and promoting the fact that we need to have really engage with our physical health and physical activity as well. Watching TV, yes, definitely can be relaxing, and eating and drinking. I think what we don't overlook is eating and drinking as a sociable exercise. And that, mixing with your family, even if it's just on a table, having a conversation around a dinner table at home, as opposed to a restaurant, could, it makes so much difference to people's well-being and engaging with people as well. Other, I'd be intrigued to know other in the Q&A session after this, at the end of this webinar, what the other is. And certainly relaxing, yeah. So we need to, and it's quite unsurprising to find relaxing at one of the lowest ones, which really screams what we've been saying in this webinar as well. It's that it's finding time to relax, it's thinking about our well-being and where we find the time to relax as well. And with the high pressure jobs that we have within nursing, how difficult is it to relax? Next slide.
Thanks,
Thank you very much for those who participated in the Mentimeter. And that's just a reference list for anyone who wants to reference this. I'm now going to pass over to Ben. I'll pass the baton over to Ben, who will now.
Thanks very much, Rohit. Really fascinating. Interestingly, I'm also a scroller, but I'm not yet on TikTok because I have exercised self-restraint, because I probably spend too many hours on that too. Okay, so for those that haven't met me before, my name is Ben Davis. I'm currently OD Director for Nuffield Health, so I oversee all aspects of development across the charity. I am a nurse by background and a nurse tutor. I spent my career working in theatres, public health, and also academia. And today I'm here to give a provider's perspective on this very important topic and showcase what Nuffield Health are doing as a provider to champion nursing wellbeing. I have no slides. Very much want to talk to you through reflections and organisational experiences. I think, building on the words of my colleagues, the first thing I really want to call out is that, in my view, organisations have a responsibility to create healthy working environments that see the whole person. So who the nurse is in and out of work. And I think that's absolutely key. We cannot expect the best of people if we do not see who our people really are. If we think about nurses, how can we expect nurses to deliver the best care if they're managing unresolved issues, if they're suffering with ill health, or wondering how they next put food on the table? And I think the Healthier Nation Index earlier referenced 65% less productive. If we think about how this could translate to care delivery, it could mean that services are less effective. It could mean that care isn't at the quality that we want it to be. And those are just two of many examples. Excuse me. So for me, it all starts with listening to understand. It's very easy for organizations to make assumptions about what nurses need, but in order to make impactful decisions, we have to listen to the workforce. We have to obtain data, and we need to be strategic in our approach. Now, interestingly, the 2022 CIPD Wellbeing at Work survey, and for those of you that don't know, CIPD is the professional body for HR professionals. That highlighted that only half of organizations surveyed were doing this, and that 1 in 5 organizations were doing nothing at all. Therefore, my questions for you to reflect on today are, number 1, what is your organization doing? Number 2, are they listening to your needs? Number 3, could they do more? And 4, if they could do more, how can you help them? Most of the initiatives that we've deployed at Nuffield Health stem from listening to our people. Now, there are multiple aspects to health and well-being, as we've alluded to on the webinar today. Physical health, mental health, spiritual health, financial health are just some of the many examples. And sometimes it can be really easy to focus on the organizational priorities, sickness and absence management, attrition, presenteeism, all the things that we hear about, without really listening to the workforce and hearing their needs and what's most impactful for them. Now, this is absolutely critical as, number 1, every organization is different. We are an independent provider. By definition, we are different to the NHS. Primary care providers have different challenges to secondary care, etc. But also each workforce segment is different. Now, we have a national footprint, so we have hospitals in all aspects of the country. And for us, that means that the needs of our nurses in London are absolutely not the same as those in Devon or Scotland. So you need to ensure that you've looked at all areas. There's also a massive evidence that suggests that if you adopt a bottom-up approach and you listen to the workforce and get it right, then the organizational outcomes will follow. So the sickness and absence improves, attrition reduces. It's just flipping the perspective and addressing the needs bottom up rather than top down. So one of the key priorities at Nuffield Health has very much been around how can we improve our listening capabilities? How can we improve our ability to engage with our nurses, our other clinicians and non-clinical teams, which in turn should enable us to be data and employee-led in our approach. Now, Gemma referenced psychological safety earlier. I'd probably reinforce here that the creation and maintenance of a psychologically safe environment is a key priority, because if staff don't feel able to speak up, then we as a provider have nothing to listen to, or we receive sanitized responses, which, then you're asking what's true and what's not. In terms of initiatives, we introduced an employee engagement platform around 2 years ago that's provided us with a range of insights. So every period we survey nurses, all of our employees on a range of matters, including wellbeing related topics. For us, that then enables us to gauge where our people are at that point in time, but also to identify key themes that we can build and act on. We've also introduced employee-led interest groups that represent a broad number of areas. So the Pride Network, Muslim Network, etc. These have helped us to create borderless communities for our people, whilst also providing a source of escalation so we can be more responsive to the specific needs of those populations. So a key focus for us of late has, of course, been Ramadan. So we've looked at how we can create a suite of resources for our teams that supports them with fasting in the workplace. These networks have provided useful insights, but also highlighted that organizational well-being, the employee well-being agenda cannot be standalone. It very much fuses with equity, as Rohit has alluded to. Blanket approaches are a first start, but in a diverse society, a best practice health and well-being strategy is one that needs to be tailored to both the individual and to the community. And just looking a little bit more about the initiatives that we've done off the back of these listening activities. So we've referenced cost of living crisis today, and have certainly recognized the impact that financial health and how much of a priority this is for nurses and all of our employees. Now, we made some amendments to our offering about 12 months ago and introduced a flexible salary finance scheme. We also introduced a hardship fund so that any of our nurses or employees in extreme situations can access something non-repayable. It's been incredibly well received and used, which is probably suggestive of its value. And in terms of an offer, yes, it requires investment as a provider, but what the return on that investment has probably paid dividends 10 times over. Mental health, we are a mental health provider, so we do have the ability to deliver a consistent mental health offer for our nurses and other employee groups, so that they all have access to triage, free mental health wellbeing services, etc. But not everyone else requires expert support. Sometimes people just require the tools to self-manage. Hence, we've subscribed to an emotional wellbeing platform that contains a variety of resources that can support, educate, and help people to help themselves. And any organization can access one of those, or can look at partnerships with those providers. And finally, physical health. We've referenced this, but nursing is an incredibly physical job, but physical health is probably one of the greatest challenges for nurses. Irregular shift patterns, long days means it can be really difficult to maintain a routine, as many of us know. But combined with personal responsibilities, sometimes the last thing many of us want to do is exercise on your day off. Yet the benefits of exercise on health and well-being are absolutely tremendous. Sleep, mood, fitness, endurance, injury prevention. There's a broad array of outcomes that are associated with fitness and well-being. Again, for us, we're very fortunate because we can provide free gym access to staff. But even then, getting to the gym can be a challenge. So consider, how can you make simple adjustments to your routine to achieve your 150 minutes a week? We've talked about the 5 in 5, taking the stairs, getting off the bus early, as Mark referenced. Alternatively, there are 24/7 exercise platforms. We've got one that enables people to access a range of workouts at home. That's a time that's convenient for you. So if you've just come off night and you're wide awake at 11 o'clock and you want to do a workout, you have the ability to do that. I've tried to give a very brief insight into what we value and just some of the things that we are doing at Nuffield Health. But before I hand over to Teresa, the one thing I just wanted to re-emphasize on this webinar is, as a provider, the importance to listen is paramount, whether that's listening to your networks, whether that's listening to your data, listening to your nurses, of course. It's that listening that enables the creation of effective strategies that hopefully then are what your nurses and what your employees want. Teresa, over to you.
Thank you very much, Ben. So thank you very much for inviting me today. It's a real honour to be part of this really important conversation, and one that I'm really passionate about. As Lucy said at the beginning, I'm the current chair of Nurse Lifeline, which is a charity which I'm going to share a little bit more about with you in a few minutes. But I'm also a nurse of 38 years, and I spent 27 years of those 38 years in the military in the RAF, and recently left. And this afternoon, I'm just going to spend a couple of minutes talking about Nurse Lifeline. But as nurses and midwives, we spend all our professional careers giving on a daily basis. So it shouldn't really come as a surprise that this increases our risk of fatigue, vicarious trauma and burnout, just like we've heard already. It's therefore essential that we know how to balance both our professional and personal giving by making sure that we constantly refill these giving reservoirs, just like we recharge our battery. And we do this by making sure that we are resilient. And I'm going to be a bit controversial here, because I know that since the pandemic, I recognise that the word resilience is one that has often been overused in the healthcare setting and not always well understood. As Steve mentioned the word earlier, with negative or positive connotations. And I think it's possibly because individuals have been repeatedly told that they need to be resilient, with wellbeing training frequently feeling like a tick box exercise rather than something that is valuable. This, I plea to you, though, is, however, not a reason to throw the entire concept of resilience out because we no longer like the word or its perceived connotations. And having worked as a military nurse for 27 years, to some of the most austere, challenging and dangerous environments in the world, the one thing that got me through was having resilience. It doesn't stop bad things happening, and you still go through the most intense emotional roller coasters, but what it does give you is a known handrail to be able to successfully manage these emotions and challenges. So resilience is a real thing and very necessary if, as nurses, we want to deliver safe, high quality care every day, day after day, year after year. And in our nursing roles, resilience is more than the old definition of being able to bounce back from adversity, but much more about how we manage our emotional well-being, our mental and physical health, like we've heard from all the speakers this afternoon. And my plea to you is, if you are still one of the resilience doubters, please don't just dismiss it as a trendy fad without first finding something else to replace it. Ensuring our batteries are regularly recharged and that our resilience is high is both an individual and an organisational responsibility, and that's been mentioned earlier this afternoon as well. It is something that needs to be planned for and incorporated into our daily and working routines, and it shouldn't be just a random act or ad hoc activity, and nice to have when we have time, or only considered when something has gone wrong. Like Rohat said, it has to be embedded into our systems and culture. But how do we do it? So you've heard lots of brilliant tips and ideas today, but one size doesn't fit all and won't work for every nurse. Resilience is different for all people and for all different contexts. So I like the idea of creating personal resilience wellbeing toolboxes that contain different services and activities that work for you. So some examples from my personal toolbox include peer-to-peer support, going for a walk, breathing exercises, talking to friends, one-to-one counselling, reflection, spending time with my rescue dogs and being in my garden. But what I do is I make sure I use whatever tool I have to actually, align to the issue that I've got. So for the next couple of minutes, I would just like to share with you another service that you might have heard of but not been very aware of is Nurse Lifeline, and perhaps consider adding it to your personal toolbox. So what is Nurse Lifeline? Well, Nurse Lifeline is a registered charity which focuses on improving the mental health, resilience and emotional well-being of nurses and midwives across the whole of the UK. The charity was set up in 2019, pre-COVID, by a group of absolutely inspirational junior frontline nurses and midwives who recognised a critical gap in their emotional support. And in it, it's the UK's first national, confidential, free and peer-led listening service for all the nursing community. And this includes nurses, midwives, nurse associates, healthcare assistants, care staff, students, and their families and friends. And it's staffed by an amazing volunteer team of more than 40 qualified nurses and midwives across the UK. And the idea was, however big or small the issue, the charity founders wanted to provide a safe and non-judgmental space for the nursing community to turn to when needed. As a peer-to-peer model, the service has been designed to provide a safe space for our nursing community to offload and decompress with like-minded individuals, all who are united by a common experience and shared understanding of what they have been through. So Nurse Lifeline is not a crisis line. We are trained to deal with crisis, but it's not a crisis line, but a service to be used before individuals reach this point, in ideally a bid to ask for help to prevent burnout and fatigue and other issues. Most common themes as to why people call the line are related to toxic work environments, bullying and harassment, and not being able to deliver the quality of care they want because of operational pressures and other issues, and being put into positions that they feel exceed their competence. I think those were mentioned right at the very beginning and aligned to some of the reasons in the RCN survey. Our service currently runs every weekday evening from 7 till 10. And our vision is both bold and ambitious. Firstly, we want every nurse and midwife and all of the other groups in the UK to have our number, but more importantly, be able to feel comfortable in calling us. We're a listening service. We're not there to advise. We're not a helpline. And again, as Gemma said, we're there to listen, to hear. Secondly, and this is much more complicated, and this is where we need the whole nursing community to come together, is we want to help change the culture in how nurses and midwives look after their mental health and emotional well-being by empowering them to take control and normalising asking for help when they need it. We want to prevent nurses and midwives waiting until there is a crisis before asking for help, which is what we find quite a lot. And our aim is for nurses to recognise that if they've had a bad shift or an event, or even if they haven't had a bad shift but want to talk to somebody, that they do something about it rather than lock it away to be dealt with on another time. We want to reduce the accumulation of issues that eventually cause staff to feel so overwhelmed that the only solution is going off sick, or worse, leaving the profession. We're also looking at new innovative ways of reaching more of the different nursing sectors, and by launching different ways to access our support. We very much recognise that speaking to someone on the phone is not always the preferred option, so we're currently scoping callback and other email options. But Nurse Lifeline is just one of many tools in an individual's emotional wellbeing toolbox. It is, however, only through working together and building partnerships that we will be able to affect any real impact in changing the culture of how the nursing community looks after their emotional well-being and mental health that we've heard about, and I think is one of the underlying messages of this webinar today. But how can you help us? By sharing the number on the screen. I'd be really grateful if you could write that number down, put it in your phone and log it away for a time when you might need it, or share it with a colleague. If you are interested in becoming a volunteer and a call handler, then please get in contact. And also, of course, as a charity, we're always looking for help in raising essential funds. To end my session, I'd just like to ask a quick question. So we go on to the next slide. This is an interactive element for yourselves. It's interesting to note that everybody identifies Nurse Lifeline as an amazing organisation and such a worthwhile and important service. But interestingly, we don't receive the amount of calls that we'd expect. So this question is about the different types of platform that you would find useful and you would prefer to access. So the question is, what would be your preferred method or platform in seeking help with your emotional well-being? And if you can please rank the following, and I'm not sure whether you can see those. And if not, I'll read them out. So the first one is peer-to-peer supervision by known colleagues. The second is helpline via email via helpline, drop in and talk to somebody like the hub and spokes, counselling on a one-to-one basis, a listening service, or a helpline. And I'll just give a little while for those to go through. And this will be invaluable for us going forward. So thank you very much for participating. And whilst that's carrying on, I will conclude and hand back to Lucy.
Thank you so much, Teresa, and God, what valuable insights from each and every one of you on the panel today. We haven't got a huge amount of time for questions, unfortunately, but there's been some wonderful dialogue in the chat box that obviously we'll save and share more broadly with the panel as well. I do have a quick question. I think it was James was asking around professional support. James popped something in the chat, and I didn't know if you wanted to ask the panel. We'll just keep an eye on that Mentimeter while it goes ahead there. Really valuable information for Teresa and the team to make sure they're providing the best service through Nurse Lifeline. And I've popped the link to the website as well for you to share with your colleagues to ensure that everyone's got access to that as well. And being a charity, it's open to all nurses and midwives from across health and social care as well. So fantastic, drop in and talk to someone anytime, counselling as well. James, thank you so much for joining us this afternoon. I understand you've been doing you're a Darcy Fellow and really taking a keen interest in professional and personal wellbeing. I think that's what you popped in the chat. You had a question around professional wellbeing, didn't you? Would you like to pose that to the panel? And we'll see who would like to respond to you, if that's okay. Gemma, thanks so much for joining us. The other panel, if you could pop your cameras on, that would be amazing.
Yeah, sure. Sorry, thank you all so much. That was really interesting and great to hear sort of very different perspectives on things. So my work really is focusing on encouraging staff to engage with whether they have good or bad days at work. The NHS Select have a great tool for that, but then taking it a step further and actually trying to find out what makes their days good or bad, and then enabling them to make the changes to improve their working lives. So I guess my question really is around a lot of what you talk about, I think could be applicable to doctors, teachers, everyone's mental health is important and would have been impacted by COVID, no doubt. But how do we focus on improving our professional well-being as a profession at work, rather than just things like resilience and employee assistance programs, which are of benefit for everyone, I would suggest.
Thanks, James. I might go to Gemma first, if that's okay. I can see her nodding. She's unmuted to answer, and perhaps to Ben or Steve after that as well, just to answer. Thanks, Gemma.
No problem. Thanks for the question, James. So I think the forum where this sits is where there is an evidence base to support is through areas like clinical supervision, where the focus of the sessions are around the professional issues that are impacting upon well-being, and there's a structure and a kind of format for that to be processed in a way that is around the restorative element, the well-being element, but also around the professional ethics of a situation, the professional development that's needed to respond to that, and also looking for different perspectives from other professional groups where that can be multidisciplinary. The other area that we've seen that being really effective is in Schwartz rounds, again with a really excellent evidence base to support the impact of those things, particularly from a multidisciplinary lens, where we start to see that actually the issues are across all professional groups, and that by bringing people together in that safe environment to explore the emotional impacts, there's great learning that can be had. So they would be the examples which I would give, where organisations can embed those forums really into what they offer to employees. I guess the challenge for that is always around access, and it tends to be those practitioners that are in the most highly demanding areas that struggle to be able to access those things, particularly where there's a 24-hour care rota that needs to be staffed, and that's the real challenge, I think. But yeah, they're the kind of structures I would know of and recommend.
Thanks, Gemma, and thanks, James. I'm just mindful of time, and I just want to make the point that if you pop any questions you want to ask, we'll come to the panel outside of this meeting to make sure we reply, and we'll pop that in the follow-up email to make sure that you'll get your questions heard and everything. But Steve, I've got a bit of an interesting question for you actually that's come through. It's a decade since the Francis report on mid-staffs. There's been a lot of lessons on speaking up and culture changes linked to staff wellbeing. What are your thoughts around this, and what would you share with the group, and perhaps any of the panel if you wanted to interject as well on that?
Yeah, sure. Well, it was a seminal report when it came out, and it had some very, very important lessons, which we mustn't forget, essentially. And a lot of those were around sort of speaking out, raising concerns, and a little bit like what Gemma was alluding to, listening to people, basically. I think it's just that ability to make sure that when people say things, they don't just disappear into a black hole somewhere, that they are listened to and taken note of and acted on, hopefully. So for the safety of everyone involved, but also for the well-being of everyone involved, because a lot of it comes down to people wanting to make sure that their voice is heard, I think.
Well said, Steve. Thank you. Thank you. So important, so valid. Well, I'm mindful it's only 4 minutes to go, so I'm just going to quickly summarise and bring the key points from all of our amazing panel to say thank you, an enormous thank you. So firstly, Mark talked about shared the Healthy Index national survey that NUFL completed with the 8,000 responses, and it's about that hashtag #find5. So just start thinking about where you can find 5 minutes to do something that's good for you, not necessarily about exercising or taking the stairs instead of the lift, as Mark said, but also about taking time to meditate, relax, reset, whatever that might mean for you. Gemma, you and Steve, you came on about really the importance of reflective practice as well, and that psychological safety. So really thank you so much, Steve, for sharing Are You OK campaign as well. What a fantastic campaign to be shared. Gemma, about role modeling, and I really did take a lot from that as well. Making sure you take your annual leave and you switch off, and making sure you spend time on your family and those personal, making sure your personal and professional lives you've got that good work-life balance that we all need to ensure is in place for healthy well-being. Rohit, you made some really good points there about the international educated nursing community, how we can support those, and focusing on culture. And it really made me think about the work that we're doing, the International Nursing Midwifery Associations, that Rohit, you're obviously the founder of the British Sikh Association, but we've got 24 associations set up to support nurses from different cultural backgrounds as well. So a fantastic resource there as well. And I really liked your focus on meditation as well, something I will take back as well, taking time to breathe and reset. Brilliant to hear what's happening at Nuffield, Ben, and I think really fantastic initiatives that can be shared across the health and social care sector about focusing on well-being, speaking up, and it really is important to speak up. I think there's some really important valid points in the chat around racism and bullying, and actually we really need to address that. Racism is not okay, and it's that we will need to speak up and make sure that the voices are heard, and to Steve's point, that actually it's not just listening, it's actually action is taken as well. So it won't be tolerated. But thank you for everyone for adding your comments in the chat box as well. And Teresa, what a wonderful thing to finish with is actually there's a lifeline. There's somewhere that nurses and midwives can go for help and support. And it's fantastic that you've got that feedback as well to make the service even better. We'll share the link, obviously, far and wide. We encourage everyone on this call to do so as well. There's also the Shiny Minds app that's available for NHS staff and some other organisations as well. So I'll pop the link in the chat there for you as well. Lots of really valuable resources, but I guess the big main takeaway is look after yourselves. We're all very, very good at looking after other people, but actually, if we're not healthy, it's that analogy, isn't it, with the oxygen mask? We have to put it on ourselves first before we can really take care of others. So #find5, #find5. Please do share far and wide. Obviously, just to reiterate, this webinar has been recorded. Will be available to you tomorrow on our YouTube channel. We will send a follow-up email, so you've got access to that and the links, but please do look after yourselves. Thank you so much for your time and attention today. It's been a really, really wonderful webinar, and a special thanks to Mark, Steve, Teresa, Ben, Gemma, Rohit. What a wonderful session, a privilege to host with you all today. Thanks all, have a really good afternoon and a really good week, and we'll see you again at our next webinar. Thank you.